So thanks a lot. We've just finished the formative OSCE and we've got the general practice team here. And we're just wondering if you guys could tell us some of the good things that were done by the students that you've just seen.
Sure. So firstly, I'd be happy to have the students that I saw as my doctor. I think that they came across really, really well. Their knowledge was good, and they were just, very personable and came across very well in the OSCE.
Fantastic.
Yeah, they were very patient-centred and asked good questions, and good knowledge is good investigations and not over-investigating.
Excellent, excellent.
And just the way that they opened the history taking with the patient, asking for if this was privacy over the telephone, permission to speak to the patient. I think they did all that really well. Empathic, open questions, summarising, all those things that we've taught them in the communication skills.
Fantastic. And that was the tricky part. What were the things that were not done so well that could have been improved by the students, do you think?
I think they could have kept going back to the trigger. And therefore not closed off the diagnosis, only sort of looked at various things. For example, there was a family history there that they could have considered if they'd just gone back and recalled all the points in the trigger. In terms of not jumping to the early diagnosis, as that would be missing some serious potential causes by doing that, and I think others will have more to say about that. And also just remembering to be systematic every time, and remembering, your lifestyle, diet, exercise, smoking and alcohol in every history that you take.
I think really listen to your patient, listen to what they're saying, and use the cues that you're being given. So I think it's really, really essential that you're being given lots of information and you have lots of information to cover, but really focus on what that person's saying and let that trigger in your mind rather than moving on too quickly without actually thinking about the significance of what they're saying.
Great.
Always ask what else it could be. Even if the diagnosis is obvious, always consider if there's another possible diagnosis. Your Murtagh masquerades can help you there. Don't forget biopsychosocial. So mood is really important to consider as well.
Fantastic. And what are the Murtagh masquerades?
They are diabetes, drugs, depression, UTI, thyroid dysfunction, anemia, and spinal dysfunction. Although I add pregnancy to that, any woman of childbearing age, my 8th masquerade.
Fantastic. And is there any other sort of general advice you give about OSCEs for the general practice OSCE stations?
They're always patient focused, so treat it as a patient, not an OSCE. Don't think of someone marking you ticking boxes.
Yeah. Oh, well, just think about the social context. Age is really important. Asking a little bit about their occupation. There's supports at home. All those kinds of things to put the patient into context.
And I think a really important thing is asking those beautifully open questions early, but then allowing the patients to talk. I think because we know that people are under pressure and we know that you've got boxes to tick to get the points, it's really easy to ask those lovely questions, but then jump in and close patients down. So if you're able just to sit back a little bit, people will actually give you a lot of information if you can just listen to them.
Okay, fantastic. Anything else you wanted to add?
If you finish early, don't just sit there looking embarrassed. Go back to the patient, either summarise or ask the patient if they've understood everything, or summarise what you're doing, because something else might come up, and that's what you do in general practice. You go back and check with the patient.
And as you said, keep asking the question, what else, to yourself, what else could it be, and what else can I ask?
The triggers are always very specific, so refer to the trigger. If management is not in the trigger, then don't waste time talking about management.
Fantastic. Thank you very much.